All right, then, so on the first segment of the program, we're looking at cancer awareness for women, protecting your health through knowledge and action. This is an outreach courtesy of RJOLAD Hospital, and this is the fourth installment since we started this campaign a week ago. Dr. Marcus Mbakwe is joining me in the studios right now. He's consultant obstetrics and gynecology with RJOLAD Hospital. Nice to have you in the building, Dr. Mbakwe. Good morning.
Yeah, good morning.
And how are you doing?
I'm fine, very fine.
Good. So let's talk about this. I know that we've been trying to reflect through different ailments and, of course, the importance of screening and all of that from the viewpoint of RJOLAD Hospital. Today, we're taking it a notch higher and we want to focus on cancer. Before we even reflect on cancer for women, let's dwell a bit on cancer as a disease itself. Well, what is cancer? Let's break it down for our listeners this morning.
Yeah, cancers generally can be defined as abnormal growth of cells in any part of the body that can spread to other parts of the body. In a layman's terms, I think that's the definition of cancers.
Abnormal growth
of cells from any part of the body.
Right. It just happens like that, or there's a reason why it comes to be.
Yeah, that's a question so many people want to know. What causes cancer? The cause till date is still not known, but there are risk factors. It just happens like that. There are risk factors for cancers, why some will have it and some won't have it.
Yeah, so that means you doctors have not done enough job.
Yeah, a lot of research is still ongoing on different types of cancers. Like I said, any part of the body can be affected.
Yeah,
no part is spared, actually.
Because, for instance, now if I ask you to tell me about diabetes, you guys are so quick to say it is caused, this is that, you've got this kind of factors and all of that. How come you guys are not able to find out what the real cause of cancer is?
And there are lots of research, like I said, going on. There are risk factors for cancers, but the cause completely, you can't say this is the cause. So many risk factors out there. Maybe as we move on, I'll shed some light on them.
Are all cancers the same?
No, not all cancers are the same. Different body parts can have cancer. You can have cancer of the breast, you can have cancer of the cervix, you can have cancer of the womb, call it endometrial cancers, all different types of cancers.
All right. So let's talk about this now. So we are concentrating on cancer for women.
Yeah.
Why that?
Because cancers for women, because I'm a gynecologist, and cancers for women because that's what we deal with as gynecologists. So that's why I'm representing the gynecology department here.
Right. Okay. So what are the precise cancers that affect women?
Yeah, the commonest cancers that affect women is actually breast cancer. Breast cancer is one of the leading causes of cancer worldwide, actually. And in our own environment here, second leading cervical cancer is also very common. And of course, ovarian cancer. The cancer of the womb itself, we call that endometrial cancer. Then we can have cancer of the vulva, we can have cancer of the vagina itself. These are just abnormal growth of cells. These cells just start growing abnormally, and then if they are not controlled early, they are not detected early, they have the potential to spread to other parts of the body.
All right. So, Dr. Mbakwe, from what you're saying now, it means cancers can spring up in any part of the body. That's what it means.
Yes, that's what it means. Yes.
All right. So now you've mentioned about 4 or 5 cancers that could affect women.
Yeah.
Cancer of that's cervical cancer.
Yeah.
You talk about breast cancer,
ovarian cancer,
and all of that.
Endometrial cancer, uterine cancer.
Oh, uterine. Okay, so they comes in various forms now, even the one of the womb too.
Yes, please.
All right. So how do women now know, or how will they know that they are coming down with any of this?
Now, the good thing with cancers, a good thing for us doctors is that if you screen early, you can actually detect these cells early, and then you can intervene early to prevent them from spreading to other parts of the body.
You mean it?
Yes. Once you detect them very early, and that's where screening comes in.
Right. I know that there's always this talk about cancers appearing in stages.
Yes.
Is that correct?
Yes, very correct.
How many stages?
Yeah, it depends. For most of them, 4 stages in all. Stage 1, stage 2, stage 3, stage 4. But even before then, there are some precancerous stages. That's before the cancer even starts occurring. There are some we call them precancerous, or what we call pre-malignant stages.
Right.
Yeah, for those. If you take them that early, then you don't have to get to the stage of having the cancer itself.
Is there any point where it becomes irreversible?
Towards the end, it's not, but when it's advanced, we call it advanced, not irreversible per se. We call it advanced. When it's advanced and spread to other parts of the body, then the prognosis is poor.
At what stage is that?
From stage 4, sometimes stage 2, 3, 4, there. But when it spreads to other parts of the body, then it becomes.
Because I was just about to ask, I'm asking that question because just last week, we lost a dear one to us, and at the point she was diagnosed, which was sometime around August this year, she was at stage 2 of breast cancer. So, and we are wondering, this is 3 or how many months down the line, somehow we lost her. So I'm wondering if people can actually lose their lives at stage 2 of breast cancer?
Yeah, so sorry about the loss of your loved one. It's really painful because worldwide cancer is the second leading cause of death. So that's why it's better we make people to be aware about cancers that they exist. For breast cancer, it depends on how fast it has spread. Metastasis is the issue. The breast is just at the chest, can spread to the lungs, can spread to the brain very easily. And when that happens and affects those other organs, it can be difficult. Most times when it's advanced, when it spreads to stage 4, prognosis is always very poor. We rate it in terms of prognosis, giving 5-year survival rates and not others.
Right. So, but someone shouldn't die from stage 2.
It depends on
how it has spread.
Exactly.
All right. So let's talk about the other ones now. Breast cancer is very common, right?
Yeah, it is.
And do people survive?
Yes, if you detect early. Early detection is the key word here. I think what we should go home with this morning is early detection. For breast cancer, a self-breast examination is good. Once you can identify any lump at all whatsoever, a woman tries to examine her breast herself, it identifies a lump, she should immediately and feels that this is not normal, just to notice that this is there on the breast. She goes straight to the doctor to see the doctor, and the doctor takes it from there.
All right.
For cervical cancer, the same thing is there's a screening. In developed countries, for example, they do a conventional pap smear. From 25 years of age, every woman must be screened in the UK, for example. And that's not that we call it universal screening, but we've not gotten to that here in Nigeria. We do what we call opportunity screening here in Nigeria.
So at what point can a woman catch any of this? I mean, for breast cancer, for instance, is it age discriminatory?
Yes, that's why I said about risk factors. All these cancers have risk factors. Advanced age is a risk factor for many of these cancers. For breast cancer, family history too is another risk factor. Maybe you have a sister, a first-degree relative, a mother that had breast cancer. You have to be more vigilant about your own health, and those are risk factors. So smoking is also another risk factor for breast cancer. Early menarche, a woman who starts seeing her menses very early, before the age of 12, and then late menopause also risk factors for breast cancer. So these are some of the identifiable risk factors for breast cancer. For breast cancer.
Right.
Yeah.
Well, I'm having a thought because of the time that we have on our hands. The likelihood of us extending this is going to be very, very high because we're looking at different cancers that affect women. But typically for breast, for instance, breast cancer, what are the signs that would show that this woman is coming down with breast cancer?
Yeah, some of the earliest signs, like I said, is a lump. One can feel a lump in the breast. There can be a lump in the breast. There can be blood coming out of the nipples. There can be nipple retraction. There can be lymph nodes, swellings in the axillas, lymph nodes in the axillas. And in advanced cases, when it has spread, difficulty in breathing, sometimes weight loss. All these are some of the presentations that breast cancer can come with.
The size of the breast, does it matter?
No, it doesn't. It doesn't matter.
It doesn't?
Yeah, it doesn't.
Okay. So because we have to clarify that some might have the misconception that probably it's because this lady has, these very big boobs. That's why.
No.
Okay. So it doesn't really matter.
It doesn't matter.
Right. Yeah. Okay. So that's for breast cancer. If we switch and talk about cervical cancer, which is, I think, the second.
Yes. Worldwide, breast cancer is the commonest. They've been able to contain cervical cancer in other parts of the world. But here now, in sub-Saharan Africa, cervical cancer is still very common because we are still down there on screening.
Right. I need you to face that microphone properly. So,
okay.
So you're saying that in Nigeria, it's still a very, very major challenge?
Yes, cervical cancer, yes. Still a major challenge in Nigeria and other sub-Saharan parts of Africa.
What causes cervical cancer?
Yeah, like I said, all cancers, the cause is not known, but there are risk factors. The cause for cervical cancer actually is infection by a virus they call human papilloma virus. And that virus is sexually transmitted. So some of the risk factors could include starting sex at a very early age. It's a very big risk factor. We call that early coitus. Then having so many children, multiparity is another risk factor for cervical cancer. The good cervical cancer, family history is not there for cervical cancer in quotes, but early sexual intercourse, having multiple sexual partners, having a high-risk partner, a partner that has other sexual partners. All these are some of the risk factors for cervical cancer. Some have also attributed use of combined pills for family planning as a risk factor for cervical cancer.
Right.
Then infection by other sexual transmission like HIV infection can be a risk factor for cervical cancer, among some others.
Is it curable?
If you detect it very early, most cancers are not curable. Sorry to say that, but if you detect cervical cancer very early,
it can be worked on.
Exactly.
All right. Let's look at the third one. Ovarian cancer.
Yeah.
How does that one pan out?
Yeah, the good thing with the advantage that cervical cancer has that ovarian does not have is that we can easily assess the cervix. We can see the cervix, we can assess it, we can take samples from it, we can screen. But for the ovarian cancer, it's difficult. You can't assess the ovary, so that can make ovarian cancer very challenging to detect.
You mean it?
Yes, the woman can present with non-specific symptoms. Maybe I don't feel like eating, anorexia, weight loss. Very non-specific symptoms, abdominal pain. By the time we now screen, we now see that I might be dealing with cancer of the ovaries because the ovaries are actually hidden. So that's why for these ones we have to be very careful. The family history is also very important in them. Then we screen for some genes also because when they have some genes, they also have at risk of having ovarian cancer. Then once they have any complaints at all, they should please present to the hospital. Yeah.
All right. And is it curable as well? Or also depends on early detection?
Like I said, most cancers are not curable. Most cancers, but once you detect them early, then we can do something about them.
Right.
Yeah.
All right. So RJOLAD, let's bring RJOLAD in. So what do you have to combat the effect of all these cancers for women?
Yeah, the good thing with RJOLAD can provide screening facilities for women. You can screen for cervical cancer, you can screen for breast, you can screen for ovarian cancer, you can screen. And once this are noted, we can also we can actually direct them to where they can where they can have they can actually access services at RJOLAD. And then from there, if there's a need, then we can take it from there.
All right. So messages are coming in here for you, Dr. Mbakwe, this morning. It says, "Good morning, Victor and Doctor in the house." It says, "Dr. Mbakwe, please, does obesity impact a woman's cancer risks?"
Yes.
Thanks. This is Olayinka sending this one in. Olayinka, thank you so much.
Yeah, thank you, Olayinka. Obesity is also a risk factor for most cancers. For endometrial cancer, for example, breast cancer, also, for example, obesity, sedentary lifestyle. That's why we always encourage exercise, regular screening for women to reduce their risk of having some of these cancers.
All right. Yeah. Another one here says, "Good morning. Are women more at risk of cancer than men?" Bidemi from Ifako.
That's a dicey one. Now, because depending on the type of cancer you're talking about, for example, the men have prostate, so the prostate cancer is higher in men than women. But for the women, they're at risk of having more of breast cancer, cervical cancer, endometrial cancer. Everybody's at risk of cancer. However, for women, because of the different organs that they have from men, they will have cancers of these particular organs higher at risk of them than men. I'll answer that question.
This one says, "Good morning and happy new week, Victor. Thanks for this topic. Are women more at risk of colorectal cancer, and what are the first symptoms to look out for?" Tosin is sending that one in.
Yeah, thank you. There are some syndromes that come together where a woman is at risk of having so many cancers at once. It's called Lynch syndrome, where we have both colorectal, endometrial, all existing because of a particular abnormality in a gene. The Lynch 1 genes, the Lynch 2 genes. So women are also at risk of, because they have all these organs, they're at risk of having colorectal cancer because they also have a colon. However, we can't particularly say men are more at risk of having, women are more at risk of having colorectal cancer.
Okay. This one says, "Doctor, does menopause impact cancer risks?"
Yes, menopause impacts cancer risk. Like I said, for breast cancer, for example, constant exposure to the hormones produced by the ovaries, estrogen and progesterone, puts a woman at risk of having breast cancer, endometrial cancer. So early menopause, getting to menopause early can actually be protective. Yes.
So women get to menopause early? From what age?
No, the average age in Nigeria is about 51 years of age for menopause at the moment. We say it's early when it's before 40 years of age. But one of the risk factors for breast and endometrial cancer is late menopause. Early menarche and late menopause, meaning she's more exposed to those hormones over a longer period of time than those that get it early. So when a woman gets menopause early, it's actually protective against some of these cancers.
All right, Taiwo is also sending a message here. Taiwo says, "Can birth control pills increase or decrease cancer risks?"
Yeah, that's still a controversial topic in obstetrics and gynaecology.
You mean it?
Yes. Some people have said birth control pills actually put a woman at risk of cervical cancer. And some have said it protects against breast, protects against endometrial. However, it's still a controversial topic in gynaecology. I don't think I want to.
All right, let's talk about RJOLAD as we round up the program this morning on what women need to do as they take action and use the knowledge that they have. So, RJOLAD, what kind of interventions are you guys bringing on board?
Yeah, the most important intervention, prevention is always better than cure. So, we want to identify these things very early. We want to make women know that they can be screened. We want to make them know that screening is very important. Identify it when it has not started causing or producing any symptoms for the patients. And that's where the pap smear comes in, educating about the self-based examination comes in, offering there are a lot of packages they have for screening women, identifying these things early, and then doing the needful to prevent a pre-malignant or a precancerous lesion from becoming a cancerous lesion.
All right. Yeah. And how can they get in touch with you?
RJOLAD has branches around Lagos. I think they're in Bagada.
Okay.
They have the headquarters. Then they have in Solo. They also have in Agege. And they have.
All right, so they can get to any of these places
Yes.
and be properly screened.
Yes.
How often can one screen for cancer?
Yeah, beautiful. Depends on the type of cancer. For breast cancer, it's almost a woman should at least once in in 6 months do a self-breast examination. Examine your breast yourself. You don't have to call. You don't need a doctor for that. Just examine your breast. Once you notice any abnormality, any lump, you come to the hospital. For cervical cancer, in the UK, they start at the universal screening actually starts at 25 years of age. So from 25, every woman who is sexually active should start screening. You screen every 3 years till you are 49, and every 5 years till you are 65. Then you can stop. There's a place for different types of screening tools. I don't want to go into that, but
Right.
that's basically when you start from 25 years of age for any woman who is sexually active. Thank you.
All right, then we'll leave it at that for now. It's nice having you in the building. Thank you so much for being here.
It's always a pleasure.
All right, Dr. Marcus Mbakwe is consultant obstetrics and gynaecology with RJOLAD Hospital. And on this fourth installment, we've been able to reflect a bit on what women need to know about cancer and how they can take action and use the knowledge that they have to protect themselves. A brief break. When we return, we'll do our birthdays.
Nice. I take it one.